Pectasol chelation complex is a unique, effective and safe chelator of heavy metals. It is really the only oral chelating agent that has been subject to clinical trials and have been published in peer-reviewed journals. It have been shown to be effective. Pectasol chelation complex is a combination of our modified citrus pectin and modified low molecular weight alginates. Over the last 15 years, we have been researching modified citrus pectin both for its cellular benefit, but as well for its ability to chelate and remove heavy metals and toxins. The idea of using modified citrus pectin for chelation of heavy metals and toxins occurred to me after the Chernobyl incidents in the 1980s. After the nuclear accident at the Chernobyl nuclear reactor, there was a very high incidence of children with high radioactive readings. When these children were given pectins, the radioactive readings decreased by 50 to 60%. These pectins were high molecular weight pectins and worked mainly by binding to radioactive particles in the digestive tract. Knowing that citrus pectin can be modified to low molecular weight and its structure can be enhanced in a way that can bind heavy metals in a stronger way, I developed the unique modified citrus pectin that has a low molecular weight and low esterification. It is also rich in rhamnogalacturonan 2. This means that modified citrus pectin can serve as a safe systemic chelator to be used on an ongoing basis. And indeed, we have proved in our clinical trial that we published that modified citrus pectin is a safe systemic chelator that lowers the levels of heavy metals such as mercury and lead and cadmium and arsenic and nickel without depleting the body from essential minerals. However, if you use only modified citrus pectin, you need a much higher dose. So in order to enhance the effect of modified citrus pectin, it is very wise to use another chelating agent that can both enhance the systemic effect of modified citrus pectin, but also serve as a chelating agent in the digestive tract, preventing the reabsorption of heavy metals, especially mercury, but also others. And indeed, what we found is when we use modified citrus pectin in combination with alginates, and this combination is the product PectaSol chelation complex, we can get effective results and benefits at a much lower dose. The loading dose for PectaSol chelation complex is 3 capsules twice a day on an empty stomach. You can also go up to 4 capsules twice a day if you have a case of very high heavy metals. How long should you use the loading dose? Between 1 month and a year, depending on how serious is your heavy metal issue and how serious are other health concerns that you have that relate to heavy metals and toxins. Once you are happy with your results, you can continue using PectaSol chelation complex and the maintenance dose of 1 capsule twice a day. What else can I use to enhance the benefit of PectaSol chelation complex? After using PectaSol chelation complex for a certain period of time on its own, from 2 to 8 weeks, you can now add Detox Complete, the supportive product that helps enhance the effects of PectaSol chelation complex. Detox Complete is, as its name says, a complete system of detoxification. When I formulated this product, I drew from multiple medical traditions, from multiple herbal systems, from using an herb which is used at very remote monasteries in eastern Tibet to combat high altitude, meaning an herb that allows the brain to function with less oxygen, to multiple herbs that are used in a homeopathic version in homeotoxicology, to herbs that are used in Chinese medicine, to different minerals and amino acids that can help in the excretion and discharge of heavy metals and toxins. So how does the Detox Complete work? It has multiple mechanisms. It helps to remove heavy metals from the organs, from the tissue. It helps to enhance the detoxification pathways, both through the urine as well as through the digestion. It helps the energy systems in the body to cope with the stress of detoxification, and it supports the circulation so that the ingredients which are involved with chelation can get to their target tissue. So once you are on pectin complex, again for 2 to 8 weeks, you can add Detox Complete at 2 to 3 capsules twice a day with meals for 1 to 6 months as needed. Once you are seeing an improvement in your general health and in the condition that you are concerned about, you can then continue with the pectin complex on a maintenance dose.